All right, well, it is Autism Awareness Month, and something many advocates want you to know is the importance of recognizing early signs in your child. Our pediatrician, Dr. Celina Moore, joins us now with this. So something people, parents at home wondering, what are the signs and symptoms I might recognize in my child?
The typical signs and symptoms usually present between 1 and 3 years of age.
Okay.
And usually they're missing developmental milestones that have to do with either speech or interactive social skills. So children who don't respond to their names, children who seem to be in their own world, children who don't play with the toys appropriately, and who have repetitive behaviors are children to take to the pediatrician.
Now, as we know, every child is a little different, right? Everybody develops a little differently. There are different skills. When should parents worry that something is really off?
If you have other children, that's usually a good place to start. But children need to be coming to the pediatrician on a regular basis for developmental checks. They come pretty often in the first 3 years of life. And at every single visit, we ask questions and we screen children for developmental disabilities. So at that time, if the parent has any concern whatsoever, let the pediatrician know. But usually we like to tell the parents what's coming up next in development so that they can have a look out for that at home until they come to the next appointment.
Yeah, that's really helpful to kind of have that guide. Now, why is it so important for parents to make sure that they get that early intervention? Why so early in a child's life with autism?
The brain is amazing. There's so much development that happens in the first few years of life, and you have to get that child into therapy during that really critical window when everything can be learned and changed. So the earlier and the more intensive the therapy, the better.
Okay, so obviously things are developing at such a rapid pace. We're learning new things all the time.
Yes.
What are some of the treatments to help improve learning and communication and all of these skills?
They're usually in the form of different types of therapies. There's one called ABA therapy, which is applied behavioral analysis therapy, which is kind of the gold standard for treatment of autism. Speech therapy, occupational therapy, sometimes physical therapy, and behavioral therapy that goes with social skills as well.
Okay.
Yes.
Now, I mean, we hear about autism as a spectrum, right?
Correct.
So there are different levels here. So if a parent is to hear the word autism, that could mean many things, correct?
Right,
Yeah.
and not all autism is, a grave prognosis.
Right.
You know what I mean? There's so many children that by the time they get into kindergarten are indistinguishable from what we call neurotypical children. So the earlier you get them into therapies, the more of a chance, depending on the genetic makeup of the child as well, to get them streamlined into kindergarten.
And truly, there is so much hope out there with what we are learning. How are things different today versus, say, 10, 15, 20 years ago?
I think the big word is awareness. Not just pediatricians, but also moms and teachers and dads are really aware of the child's development. So having the children socialized early helps us pick up these kids that might be lagging a little bit behind.
Okay, well, thank you so much
My
for being
pleasure.
here and offering some insight during Autism Awareness Month.